Hello everybody, this is your favorite doctor, Dr. Numaka Lulu, also known as Doctor for Free, coming to you from New York City. For today's topic, remember this is just an educational topic for the populace in Nigeria to avail themselves of the teachings that will make them empowered enough to question their medical care when they visit their healthcare professional, and also to be knowledgeable enough to interact and contribute to the total care of themselves. Because at the end of the day, if there is good outcome, it will be beneficial to them, not to the healthcare professional. Some people in the Western world might not understand what I'm talking about, but medical care in Nigeria is treated by most healthcare professionals as a mystery. Patients don't know what they are being treated for. They don't know the medications they are giving. They don't know the prognosis. They just tag along, and if they question, they are asked by the professional if they were medical doctors or medical professionals. So this teaching is just to empower my people to ask the right questions on several burning topics. Today, we are going to address the issue of brand name medications versus non-brand name medications, generally called generic drugs. There is this misconception that brand name medications are superior to the generic ones, chiefly because the brand name medications come with exorbitant price tag. So it is erroneously equated by the populace with being more genuine, more efficacious, more potent. But I'm here to disabuse your minds about this feeling, this belief, because it is actually wrong. What are brand name medications? See, there might be a pharmaceutical company or a researcher that goes into research to find out, to mix excipients. These things cost money to formulate the moiety of drugs and medications. So they have to go sourcing for raw materials, mixing up these things in different formulae until they get the right formula for a particular medication. When they finish this, they will have to do clinical trials. These things also cost millions of dollars. When they finish these clinical trials, where they give these medications to some people and they give placebo to others, and treat, and they try to find out over a span of time the after effects, the good effects, the bad effects, the potency. By the time they finish these clinical trials, costing a whopping sum of money, then they will brand these medications and then go into advertisement. Of course, if you do not advertise, nobody will know about your medication. In the end, it's the efficacy of the medication that will make it sellable and for people to require to use them. But before then, you have to advertise them. So advertisement also will take its own heavy toll financially. They introduce it to the market. At this point, the producer of this medication will have the patent to it, whereby the producer is the only person allowed to make this medication for a period of 10 years. This is the period that the government allows you to determine your own price. You can, depending on how people badly need these things and how efficacious they are, you can fix your price. I mean, you can quadruple, you can make it 200 times what you used to produce it. There is no competition. So everybody will buy it, in as much as these medications are good. People will need them. So they will buy them at the price that you set. The name that you give to this medication at this point is the brand name. But we all know that each of them has a chemical formulation. It is the chemical formulation that gives it the generic name. So you have this monopoly for 10 years, and nobody else can make it. Until after 10 years, it is presumed that you have made all your profits and gains, based on the amount you put into research, into recipients, formulations, into clinical trials, advertisements, pushing it to the market, and the whole 9 yards. After the 10 years that you've had this patent, then you are expected to publish the formula. At this point, other companies that make medications will avail themselves of the formula. They will then go and produce their own brand of this medication, which is the generic names. But remember, they didn't have to do any, they only will source for the raw materials, which will be available at that point because of how popular the medications are already. They also would not be doing any advertisements per se. They won't do any clinical trials. They will not do any, like I said already, clinical trials, advertisement, or any other thing that will push this thing into the market per se, except minimally. So the overhead cost for them is so infinitesimal. At this point, they will be in a poor position to fix the price that is commensurate with their effort, which is, will I say, comparatively cheaper than the first person that went through all the brouhaha to make the brand medication. This is why the generic medication or non-branded medication is cheaper. It is not cheaper because it has less potency. It is not cheaper because it has less the quantity in the excipients. It is not cheaper because it is inferior. This is what I wanted, because a lot of people in Nigeria have this misconception that generic medications are inferior and they are less efficacious. They are not. They are just cheaper because the people that made them did not have to put in a lot to make them. I don't want to go into the specific medications, but there's a very popular injection in Nigeria, even popular here in the United States. But in Nigeria, the brand name for this medication, for one time shot of it, is almost 5,000 naira. While the generic is about 500 naira. That is 10 times cheaper for the same effect. Needless to say, I treat my patients in Nigeria with the generic brand, and I do obtain the same result. So this topic is to teach you to, of course, if you have money, you can do whatever you want to do with your money. There are a lot of, would I say, crazily rich people in Nigeria, with our oil. Those people don't have to worry about this. But this message is for those indigent people, especially in the rural areas, who don't even have enough to eat decent meal. And when they get sick, they are eroded into going for brand name medications, which are very exorbitant comparatively, just because they do not know that The generic also work the same. I mean, this is just the standard thing. You could have some, scammers that can do their thing, but I'm talking of the real thing from real companies. I'm not talking of maybe fake drugs made in some little rooms. I mean, this cuts across. But the ones that are made by recognized companies, which are cheaper than the brand names. I'm here telling you that there is actually no advantage in spending so much. I have people call me here asking me to help them, I mean financially to obtain, and I educate. Why I educate them individually? The reason I decided to take on this topic here is because I see it as a big problem. I've had several people call me, and at the end of the day, I've tried to convince a good few. And of course, if you want me to get involved in your care, you need to listen to me. If you don't, then you can do what you want, especially if you have your money. Like I said, the bastardly rich people can do what they want. This message is targeted at the people who do not have enough even to eat. Generic medications are equally as good as brand name medications. You do not have to waste your money because they are cheaper and you think they are not good enough. Of course, you can do what you want to do. I know that a good few people will listen to me and change their pattern going by this video. Another thing I want to address in this same vein is the misconception also that injections are superior to tablets in Nigeria. I mean, a lot of doctors key into this because this is actually more patient driven than doctor driven, because if a patient goes to a doctor in Nigeria and he does not give that patient injection, that particular patient might not visit him again. He will go to somebody else that will give injection. I'm talking of individuals who are not critically ill to the point that they are comatose or unable to speak, unable to swallow, confused, or even moribund. I mean, these kind of people, I mean, when there's issue with swallowing, okay, or issue with absorption, that kind of thing. There are those special cases that injectables are preferable. But I'm talking of individuals that walk into a drugstore, a doctor's office, almost looking healthy, maybe cough and cold, something that can be treated as outpatient, and they want injections. And they have to get these injections. They get it today, they come back the next day. It's comical. Always, I mean, it's not comical, but I mean, it's so ridiculous if it wasn't serious. Because they believe, and the other thing is that they actually think the more painful the injection, the more efficacious. Let me tell you, if I mix up injection water, the water that you use to mix different injections to give, if you mix it and give to somebody alone, that is the most painful injection you can get, just water. So for those of you who think the more painful the injection, the more efficacious, that's it for you there. There is no superiority of injectables over tablets. Here in America, if you come and you're critically ill, we'll give you injections, most likely IV injections, even IM. But as soon as you're able to swallow, you're able to keep, not vomit, or you are conscious enough, you're coherent enough, we switch you to tablets. They might take about 30 minutes to 1 hour to be absorbed, but they achieve the same blood levels soon enough, and you maintain with this without the hassle of torturing you with injection, the possibility of injection abscess, the possibility of getting your nerves. I've seen people that got injections in Nigeria got paralyzed because the sciatic nerve was inadvertently injured. I mean, there are a whole lot of complications with injectables. Not to talk of the risk of severe allergic reaction. If you are allergic to a particular medication, your chances of having debilitating effects from the medication are exponentially higher with injectables, starting with intravenous ones, more than intramuscular, and of course very significantly more than tablets, because at the initial period it takes the tablet a longer time to be absorbed, get it to the system, and if you're allergic to it, your body will have built some defenses and fight it, and you have enough time to take counter medications that are used for allergic reaction. If somebody has anaphylaxis to a particular medication and you give it to him intravenously, that person can die on the spot, especially in Nigeria where they won't have any means for resuscitation. I mean, CPR, intubations, epinephrine, steroids, the whole. I mean, that person will have. I know a friend whose brother died that way years ago. I mean, and of course they will go and hold the person that gave the injection. Let's say if it's a drugstore person, you know how they do things there, and say it's the wrong medicine. No, it's not the wrong medicine. What happened is that you're allergic to it. Just like we take chloroquine in Nigeria, a whole lot of people have itching and scratching, and it's part of them. They take it. I mean, it just gives me itchy. People could die from that, especially if you have anaphylaxis or Stevens-Johnson syndrome or anything. But we don't know. See, there's so much allergic reactions that I encounter over here than in Nigeria. Because of the inadequacy of medical care that we have there, I always pray to God. I say, let's not have this over there. You have people, I encountered somebody here that took peanuts and got swollen immediately. The throat was closing, everything. He had to be intubated and other. This person was traveling with the family from one point to the other. This happened after they bought something on the way and they came in. When I encounter these things, I extrapolate. I said, oh my God, what if this happened in Nigeria? That person will be history. We don't have the resources to do that. It means the people. I mean, in my little clinic in my village, I've taught them these things, and we have epinephrine, we have all that, we have, but they cannot intubate anyway. So we'll try our best, but in the long run, it is this is the reason I hardly give injections in my clinic. But I have things to counter. And people do get well. So I want you to know that injections are not superior. And if you are not vomiting, if you're not seriously ill to the point that you cannot swallow, if you do not have malabsorption syndrome, if you're not comatose, don't let anybody give you injection. I've seen people who have malaria, fever, just, mild fever and all that. They have to get paracetamol injection. For what? You could take paracetamol by mouth. You could take any other analgesic. And they keep making an appointment to go by 5 times. So I don't know. Because they think if they don't get injection, they don't get better. It's a misconception. Tablets are equally efficacious. Unless there are extenuating circumstances like I enumerated above. While we're on this topic, I want to bring in the issue of IV drips. There's also this misconception in Nigeria that the number of drips you get equates with the severity of your illness. This is fallacious. What are these drips anyway? If you're not throwing up, if you meet ORS, salt sugar solution, take any kind of fruit juices, 5 Alive, even soda drinks or Gatorade, anything. If you the drip you're taking is equivalent to them. If you're not vomiting. Because they don't even have the different kind of IV drips you have your ringers, and then they don't even know over there that you can give 1 liter of drip IV normal saline to a patient over 20 minutes. I mean, if somebody in shock with hypotension, they will still be giving it. They've been trained to give it over 4 to 6 hours. I've had people quarrel with me or counter me or question me when I say to nurses, give the drip over 30 minutes for somebody with hypotension, then give a second one. Like somebody could get 2 liters within 1 hour, which is what we do here. I mean, there are people that come to me in the hospital here in acute renal failure, and they get 6 liters of fluid within 3 hours or thereabout. Yes, 3 liters of normal saline until they're able to pee. Our people don't know that. Anyway, talking about the drips, so if somebody goes to a hospital, you'll be proud to come and say, oh, I was in the hospital, I went to see this medical professional, and man, it was so severe that I ended up taking 10, maybe 10 liters of drip, 1 liter per bag, or even the 500. I mean, the number equates with the severity to them. But this is totally false. The drip you're taking, you could have taken water, taken any soda drink, taken any juice, salt sugar solution, orally. Because you're talking to me, you're looking more healthy than I'm looking now, and you're having headache, you're having malaria, you're having typhoid, and you're getting drip for what? So I decided to take this whole topic all in one to let you know that you're suffering in ignorance. And this, the more the number of drips given, the higher the charge that is levied against you. You know that. This lecture series is to emancipate you. If you have ears, you hear. If you want to do what you want to do, you are free to go on doing that. But my job is to teach you. You could have malaria and treat it without getting any injections, without getting any drips. As long as you're not vomiting, you're not critically ill to the point of being comatose or unconscious or confused or hypotensive or having any hemodynamic instability. And you can take your generic medication as against brand name medications. If you have any questions on these topics that I raised, you're free to ask, and you'll be educated further. I know that people who know me do not succumb to all these sharp practices. You dare not try it. I've given medications to, my clinic is mostly oral medications. We have injectables once in a while for serious cases. But this is far and in between. This is the topic I wanted to address today. I hope you were able to garner some beneficial points from this. And that being the case, I will advise you to propagate this, disseminate it, click, view, share, call your friends. The main aim is to teach you. This is a different medical program from most of the ones you've seen, but my program is to empower my patients to know their rights and to ask the appropriate questions when they go to their medical personnel. Thank you for listening. Stay safe, stay healthy, until I come your way again. Thank you.